I am using my beloved favourite resource, which is Past Medicine, because that is the best way to emulate the kind of questions you're gonna get. I'm really starting to understand why people say year 3 is probably the easiest year in medical school. Guys, I can't stress enough to you how helpful it is to volunteer in these opportunities in the secondary component teaching sessions. And good morning and welcome to another week in the life of a medical student, a third year medical student doing a respiratory rotation. Purpose of this video is to give you guys insight as to what to expect if you do have a respiratory rotation and what to look out for, but also get some insight as to how I balance my time, my studies, my things outside of medicine, my exercise, fitness, cooking, and still keep sane on a course like this. I'm actually having so much fun doing respiratory at the minute. We have 3 different variations of a week. So considering it's a 5-week placement, we only do one of them once and the other 2 twice. And this week for me, it is patient assessments, patient presentations, lung function clinic, and yesterday we had just 1 teaching session. So, and aside from that, obviously I've got my course work that I need to be studying that is outside of respiratory. So things like epigastric pain, bloating, chest pain we've had, different TCD cases that we have each week here in 3rd year at medical school in Manchester. So, considering it is now 7 past 10 even, I need to eat my breakfast because I have bedside teaching with one of the consultants for an hour. 2 hours even, and yeah, that should be fun because that's where basically myself and other students in my track, we will go to different patients and the consultant will actually teach us and we'll have to examine the patient and listen for certain signs. And I find that really helpful because sometimes you hear about inspiratory crackles and inspiratory wheeze or polyphonic wheeze and all these things, and what do they all mean? But it's really helpful, this bedside teaching on respiratory, because that's there to explain it to you. So you have a consultant that stands with you and basically says, you know what that sound is? What do you think it is? What do you think it is? It's great. So I'm gonna eat this and then head off. Okay, so 2 hours of bedside teaching. Then I think I'm gonna get some food at the hospital, take a phone call because in the afternoon I've got the diabetic foot exam. So yeah, a little bit of teaching, a little bit more teaching, and then I might stick around on the wards just to do some patient assessments. That is a long day of teaching complete, so time to head back home. Good afternoon, you guys. Decaf coffee at 4:30. Apple Watch Series 9, by the way. You've got to get yourself one. Unreal. So the bedside teaching, how was it? It's hit and miss. Sometimes when it's with the consultants, it can be really, really useful because the consultants pretty much know everything in that line of medicine. So respiratory medicine, the consultants will know so much. They'll give you so much in-depth, detailed knowledge, things that you need to write down on your iPad that you need to read up on later. And the way that today's group session was run, the doctor gathered the group together, all 8 of us, and asked, what do you guys want to do today? Are you happy to do a respiratory exam? And I was like, yeah, I'm fine to do that. But some of the others was like, can we have a recap? Would you mind just telling us how to do it? And I was thinking, I'm going to be doing this for the next 2 hours. We're going to be recapping over a respiratory exam, something that I know like the back of my hand now. I've done it enough times when I do patient assessments. I make sure I always do an examination. So the reality was it wasn't a useful 2 hours. I didn't really gain anything from it because what we did is we went and saw just one patient. One of the people in our group did an examination, and fine, it was useful to that person in my group to do that examination, but it did mean that all 7 of us were just stood there watching that person do the examination, not really gaining anything from it, and and then we discussed it after as a group. And quite honestly, I'd have found way more value in just going speaking to patients myself. So that's my only criticism. Didn't particularly enjoy the teaching session in the morning. And then in the afternoon, we just had the diabetic foot exam tutorial and a hydration status tutorial on how to perform both of those exams, because these are two stations which we could get in our OSCEs. Now, we actually have our OSCEs next month and they are formative, so it's just like an introduction into what to expect in year 3 OSCEs. And it was really, really helpful getting taught by the F1s, F2s, that are working at the university this year to just get a stepwise approach on what we're looking for, why we're looking for each of these signs, and just to practice on our colleagues on the course. So that was a good 2-hour session, and now I'm back home and my plan is to just crack on with some work and just get through some of the TCD case work that I need to get through. So if you guys are wondering how I am revising for my progress test, which is next week, I am using my beloved favorite resource, which is Past Medicine, because that is the best way to emulate the kind of questions you're gonna get, the multiple choice style questions, and I also love the fact that it also gives you a description on each of the questions. Now, the way that I'm figuring out how to build my sort of question banks, what I'm actually doing is I'm going through the list of conditions covered within the weekly cases on OneMed, and basically what I'm doing is I'm creating a custom revision set on my Past Med. So for each of my weeks, you can see for week 1, week 2, week 3, I've got all the specific notes and the specific topics which relate to the casework which is on OneMed. This is a really, really good way for me to track exactly what question banks I'm getting through and how I'm monitoring my progress as I go along. And it also means that, you know, in my own time when I've just got my phone on me or I've just got my iPad or I'm having lunch somewhere, I can quite literally just pull up one of the week's TCD cases and know that I'm doing content which is relevant to my casework, which I've been working my way through. I've got to say, I'm really starting to understand why people say year 3 is probably the easiest year in medical school. And that is because the way that we're examined in year 3 is in January, we basically have a progress test, and in February we have a formative CCA, which is there to emulate the CCA stations. But essentially the formative CCA isn't like a real thing, it's just a chance for us to practice everything that we're learning anyway on our clinical rotations, which are the exams, the interpretation of data, chest x-rays, everything else. And then the progress test is basically the same thing that we've done in years 1 and year 2. And actually it's more fun because we're going to be able to actually understand a lot of the questions now. Whereas in year 1 and 2, when all you understand is the biochemistry and the bioscience, you don't really have a clue about clinical medicine. Now, I'm sure there are many ways to approach revising for your year 3 exams and the progress test, but I personally find the best use of my time is to read through the different resources that are online. And my favorite ones are Pulse Notes, I use Past Medicine's High Yield Textbook, and I use Geeky Medics in addition to Zero to Finals. Those are the main 4 resources I use. And what I'll tend to do is I'll open up a document on my Notion titled that specific thing. So let's use lung cancer as an example, and I will quite simply collate all the resources together into a set of question banks that I can create for myself. This kind of acts like a directory for myself to refer to when I'm on the hospital wards, when I sometimes have a question for myself. So it basically means that I don't have to go on Google and just search it, because I've got all this information saved into my Notion. And then at the end of my workflow, I will then attempt the TCD weekly content on OneMed. And I actually think it's really, really good on OneMed, the TCD content, because it gives you a real good work through of a case, it presents it, it's interactive, it allows you to answer some of the questions, add some diagrams and fun things like that. And that is my workflow for how I work through my casework in year 3. Ooh, happy Wednesday. I have just prepared some sandwiches, a sandwich, and something for lunch, because today my plan is just to do patient assessments, speak to patients, take histories, do examinations all day long, just because I think that that's going to be the best use of my time, considering I've got my formative CCA coming up, and what better way to practice than on real patients on the wards. So it is 10:30, and on my timetable it did say I was supposed to be in at 9. But as you guys know, I value that extra hour and a half of sleep. So, but yeah, this is just kind of reflective of what it is like in clinical years, especially here on this block and the other blocks that I've been doing. My experience has been very much as long as, you know, you're there at some point and then the consultant does recognize you or someone does see you and can vouch that you've been on the placement, it's not very strict. As long as you get your sign-offs done, as long as you get your presentations done, and as long as you feel confident enough when exam time comes along, you're good to go. No one's going to check. And so I've just had my lunch after spending a couple hours, I feel like it was an hour and a half, on the ward or so, and I always go on the ward with the intention of speaking to loads of patients. I'm like, right, even though I've only got 2 hours, I'm going to speak to loads of patients. But like, today I've only actually spoken to one and then examined a second. And the reason for that is because even though my history taking an exam that I do on that first patient might take 10 minutes, 15 minutes with them, I end up presenting it to one of the doctors, we'll have a full discussion about it, we end up looking at the imaging, and then by the time we've discussed the management plan as well and I've done a patient assessment on my iPad, I find that like 45 minutes to an hour has gone by. Anyway, plan for the rest of the afternoon is I'm supposed to be on the lung function clinic, which is a 4-hour clinic where we see patients with different lung disorders, and they'll be doing spirometry, they'll be doing different lung function tests. I have done this 3 weeks ago, didn't find it incredibly engaging. There wasn't a huge amount to learn, so maybe I'll just go over there for an hour or so, see what it's like, sit in one of the clinics, and then head back over to the ward to talk to my patients. What a day! Just finished another couple histories, watched an ABG as well, and it is now 5 to 4. I've just got back from my haircut. I think it looks pretty good. Nipped into Tesco and just bought an excessive amount of Yo sushi because it was all reduced to £2.60. Spent £12 on sushi. A really good reg on the ward who was really open to allowing me to present to her. So I spoke to another 2 patients, did a full history, did a full respiratory exam, presented it to the doctor, and again we went through my differentials, we went through some investigations you'd want to do in that situation, and we spoke about what medications I'd prescribed to that person. So basically one of them was a infective exacerbation of COPD. So obviously you'd want to give them the antibiotics and the prednisolone. So I said, I looked on my BNF and I said, you know, doxycycline, job done. Considering they were allergic to penicillin, so you can't give them amoxicillin. But I managed to sign off one of my prescribing related tasks, because in year 3 we've also got a load of prescribing related tasks. So she signed that off for me. Presentation, signed that off for me. Patient assessment, I signed that off. So quite a lot done in just one day. And I also watched an ABG being performed, which is quite nice because last week we did ABGs on the mannequins and the practice arms, so that was good fun. It looks terrible to have to do, if I'm honest. Even the reg was like struggling. She put it in a few times and then had to pull it out and then restart. Patient was in a lot of pain. ABGs looked treacherous. That was good fun. And now I'm going to enjoy these and get to do some more work this evening. And so, since I have finished doing my question banks for the main components of week 6, which was on hemoptysis, lung cancer, asbestos, hypercalcemia, I've decided to work my way through the TCD exercises on one med because I find it really, really useful to do that. I think it's organised really, really well. It presents a different case and the investigations you're suspecting, the management, and also at the end it's got a really nice prescribing consolidation task, which I've actually finished right here. And I always suggest to everyone, guys, if you're in year 3, make sure you do the prescribing related tasks, because in your CCAs this is a station which you could potentially get. And what I always make sure I do is whenever I have the prescribing relating task on each of my TCD cases, I pull up the BNF, because that is what we're going to be allowed in our CCA. And to be honest, I've got to a point where I am literally second nature with doing these prescribing related tasks now. And that is because I've been doing the TCD prescription tasks. Anyway, it is now 9:30. I am actually a little bit tired and I want to get an early night. So yeah, I'm probably going to call it there. Speak to you guys tomorrow. Good afternoon, you guys. It is 10 past 12 and this morning has been so much fun at Clinical Debrief. I honestly believe that Clinical Debrief is one of the best things about third year, and it's such a shame because this is our last session with the GP that we've just had for the last 7 weeks, and from next week we're going to start with a new GP, which I'm excited to meet the new one, but we just had a great experience. Honestly, I just think it's such a helpful session to help you understand how to think more like a doctor, and I know that sounds so cliche, and they tell you all about that at university, but having a GP there, when we have a case and we break it down and then we all ask individual questions, the GP often asks us, like, why are you asking that? Just to probe us a little bit more. And like, I've learned so many good skills at how a GP approaches things. So for example, if someone complains of pain in like that area there, if someone complains of a bit of tummy pain there, she's always said, okay, what she tends to do is she thinks anatomically. So think about the things that are there. There's muscle there, there's your liver, there's your gallbladder, there's your gastrointestinal system, your intestines. So think about all those anatomical layers and then maybe start asking questions. You got skin there as well, so you can ask about that. That's just a really helpful session for me to put things into perspective and really understand from a GP's perspective. And it's really informal as well. It's proper chill. I always found GPs to be super chill and super fun. And yeah, today was a really, really good session, but was supposed to be in hospital, now decided not to. I have got a few admin related live tasks that I need to get on with, regarding my accountant and my conveyancer for the flat that I've just purchased, because my flat is finally complete. I've bought a 2-bed flat, it's finally been built, but there are a few problems with it. So I need to speak to my solicitor and my accountant, and I need to get all of those email related things submitted today so they have time to reply by tomorrow. So instead of going into hospital today, I'm going to go into hospital tomorrow instead, do a lot of my admin life related tasks today, and then tomorrow afternoon I'll spend it in the hospital. Good morning, you guys. Yesterday at work was good. I spent 4 hours there from 8 till midnight. I've now got a really busy day because at 9 AM I've got my TCD case closed, which is with the consultant and my group and all the other groups where we discuss week 13 of year 3, and actually I'm at week 6 hemoptysis on lung cancer in terms of my revision, but it's always good to be there and just digest what I can and try and contribute as much as I know. And then after that, I've got a secondary component teaching session. Then after that, I want to go on the wards, do some patient presentations, assessments, and history taking. So, big day ahead. All right, so just finished this morning's TCD case on bowel distension and change in bowel habits. If you guys are wondering what TCD is, for you years 1s and 2s out there, it is essentially the same as our clinical debrief at the end of the week that you guys have for your PBL cases, but the way that we do it is in a lecture theatre with a consultant or a reg at the front, and we work through a case as a group, and he discusses with us the reasons why, you know, we think about these investigations, the reasons why we think about this management. We basically just turn to our groups every so often and discuss differentials. But usually there are quite a few cases we have to work through, and we only actually have an hour and a half to consolidate all our week's knowledge in that one session. So generally it does feel a little bit rushed. Today we just had one case that we worked through, so it was a bit more in depth, but we didn't really cover as many conditions. Today it was more on bowel cancer and diverticulitis, and we were introduced to IBD a little bit, but yeah, it's definitely a good session. It's probably one of my favourite sessions of the week, just because I really feel like I learn a lot and I take a lot from it. But yeah, that's that, and now I'm moving on to my secondary component teaching, which is on sharing information with patients and carers. So an hour and a half of that. What a day. Finished secondary component teaching, which was an opportunity to talk to a simulated patient and figure out how to explain a diagnosis of asthma and the treatment plan that they have. It's also about just figuring out how to ascertain what a patient knows, and then the best way of delivering information to them in layman's terms, but also the structure to take. So obviously figuring out how much they know first before going into detail about how to use the inhaler, etc, etc. Then I went on placement, spoke to some patients, histories, but let's head home. Guys, I can't stress enough to you how helpful it is to volunteer in these opportunities in the secondary component teaching sessions, because in year 3 you don't get any simulated patient training, because obviously you're on the wards and that's your main opportunity to speak to patients, but in the simulated patient sessions in secondary component teaching, those are the sessions that we actually address the ethics and law side of medicine, speaking to patients, speaking to carers, speaking to family members of patients and what you can and can't disclose. So this is a great opportunity to get feedback as well from the examiner, from the doctor who was running the session today, who is also an examiner. Now for the formative CCAs next month, I really don't need to do much practice because I've done all my practice in these group sessions. So I'm definitely glad I did that. Then I went back onto the wards, did 2 patient assessments, listened to 2 people's chests, full respiratory examination. It was really good as well because one of them was an alcoholic and he had a palpable liver, and I noticed he had marked hepatomegaly. He also had shifting dullness, so when I was percussing I noticed the sound change, so that was really interesting to see. But now it is 4:05 on a Friday and I'm going to Barry's, gonna do a workout, and then I've got work tonight at Phoenix. So really, really good week, and yeah, time to do a workout. And there you guys have it. That is the end of another week of medical school. So I hope this video has been helpful. I hope it's been insightful as well for you guys that aren't yet in 3rd year or haven't yet done a respiratory placement, in seeing what to expect and what I get up to. So yeah, with that being said, I'm going to end this video here. I hope you've enjoyed it. Hit the like button, hit the subscribe button if you're new here for the weekly uploads, and also check out these other videos on my channel on different playlists about more of what goes on in my life as a medic. Anyway, I'll see you in the next one.